My name is John Hallway. I'm the Executive Director of the Quattrone Center for the Fair Administration of Justice, and I want to welcome you all here to our public launch and our first spring symposium entitled A Systems Approach to Conviction Integrity. For the next day and a half, I think we're going to have a really fascinating conversation as we approach, as we explore a systems approach to conviction integrity, what we think is a novel and interesting way to bring all parts of the criminal justice system together to try and help everybody achieve the common goal of conviction integrity and ensuring the fair administration of justice. The Quattrone Center was thrilled when we learned that we could have our symposium here in Fitz Auditorium. It's a great room. It's modern and open. It's professional, and it has a great ability to bring people together for thoughtful, spirited, and respectful debate about how we can tackle the complex issues affecting our society. All of those words equally describe the room's namesake, who I'm introducing to you right now, Dean Michael Fitz. This is actually my first, and for a variety of reasons, probably my last opportunity to say thank you to the Dean for his role in creating the Quattrone Center. And so I just want to take a moment to talk to you about Mike and tell you a little bit about his contributions and how the Quattrone Center would not exist without his contributions. Mike's been the dean at Penn for 14 years, and it's not an understatement to say that he's had a transformative effect on the law school during that time. His commitment to the fact that law and law schools are connected to every significant issue, problem, and perspective in our society has raised the bar for everybody here at the law school, and his commitment to interdisciplinary, thoughtful, and thorough approaches to solve those complex and interconnected problems has helped us all approach those problems in new and productive ways. There are a lot of data points that I could cite about Penn Law's growth under Mike's tenure, but a couple that really reach out to me in terms of their importance to the Quattrone Center and its philosophy for interdisciplinary study are the 40% expansion in the size of the law school faculty, including interdisciplinary appointments in corporate law and finance, intellectual property, international law, health law, science and technology, and now criminal law and criminal procedure. 70% of the standing faculty holds advanced degrees in addition to the JD, and nearly half of that faculty holds joint appointments with other schools in the university. For a center that wants to bring new technologies to bear and borrow from outside industries the knowledges and universal principles that can be used to improve the criminal justice system, it's a gift to have a dean who has integrated that kind of thinking into the law school faculty. And as a result, the Quattrone Center's affiliated faculty, who you'll meet today as moderators, has been an astonishing trove of support for us as we've gotten this new initiative off the ground. Unsurprisingly, the result of this has been an almost 60% growth in the year-on-year number of applicants to the law school. And that means really that what we're doing is we're changing the face of legal education, which changes the next generation of lawyers, which is possibly the most important way to address some of the societal problems that we have today. It's not a stretch to say that we wouldn't be here today and the Quattrone Center wouldn't exist if it weren't for the Dean's vision and support of these interdisciplinary approaches, and for his vision that an unbiased, data-driven hub for researchers and practitioners can identify, evaluate, and optimize best practices and improvements in the fair administration of justice. It's to my great sorrow, but I think wonderful for the university, for Tulane University, that Mike will be leaving us in the summer and becoming the president of Tulane. We'll miss Mike deeply, but we're grateful for how superbly he's positioned both Penn Law and the Quattrone Center for the future. And I personally am very appreciative for his mentorship and support during the past year. Ladies and gentlemen, Mike Fitz.
Wow. Thank you, John. I have to confess, I really didn't expect that. I also want to publicly, as I have privately, thank John for having been an amazing executive director of the center. John has been involved in startups, and needless to say, this is his passion, his love in this startup, launching the Quattrone Center. And he's done a phenomenal job, and I want to really publicly express my appreciation for him. Let me just say, this center is unique, and it's a personal pleasure, an institutional pleasure, a social pleasure to be here to talk about what this center means, both not only to the University of Pennsylvania and the law school, but to the society at large. You hear again and again that at Penn our passion for interdisciplinary work, our reaching off across fields and thinking through problems from really multiple perspectives. And the Quattrone Center absolutely signifies, symbolizes that principle and what that principle can mean for the betterment of this society. We have today truly a galaxy of experts across multiple fields to really think about one simple question, which is a commitment to improving the criminal justice system, really looking at that policy issue from, in a way, 100 different perspectives. Who do we have here? We have the Vice Chairman of the National Transportation Safety Board, the head of the largest elected public defender's office in the U.S., the Deputy Commissioner of the Philadelphia Police Department, 3 medical doctors with expertise in outcome-based medicine and medical error reduction, 2 active district attorneys, including the creator of the nation's first Convictions Integrity Unit, and a career fire chief. Of course, across academic fields, we have professors from law, criminology, economics, behavioral science, psychology, pioneers in criminal justice reform, and practicing lawyers with a deep experience in criminal law. Behind all of this is an understanding that we have to think out of the box. We have to bring people together both from different academic disciplines and the practice of the criminal justice system to really think rigorously about how to improvement. And it really goes back, I have to say, to Benjamin Franklin and his ideas about theory and practice, integrating the two of those, and thinking out of the box in terms of perspectives about how to do it. Now, I have to say, all of this exists because of 2 people, and their vision for this center, their commitment to the principles behind the center, and of course, I'm speaking about Frank Quattrone and Denise Federero. Frank and Denise really were the inspiration behind this entire effort. And I want to sort of begin by thanking them, as I think we all should, publicly for being behind this and being the reason for it. Now, I think it's important to note that ordinarily the way sort of support for academic efforts occurs is a dean or a part of a university steps back and thinks about various issues and goes out and tries support for it. In this case, it really is the donors who came to the university and had a very specific vision about what a university could do in terms of intellectually thinking about a problem and then making a difference in society. And it was through conversations with Denise and Frank and me and other people at the University of Pennsylvania that we really came to understand the possibilities of this center, and we're committed to bringing it here and bringing a group of people across fields and disciplines. You know, how often do you see doctors coming in or people from the National Transportation Safety Board and talking to lawyers about how you want to organize the criminal justice system to make the outcomes fair and make the system? That is unique. You won't see that anywhere else in the United States. And this center is truly focused on thinking out of the box as it moves forward with all of these different issues. The proof of the pudding for this center is going to be down the line 2, 5, 10 years when people will look back on the conversations, the studies, the issues that were addressed here and their impact and adoption by the criminal justice system. Not retrospectively after a case has occurred of injustice, but rather proactively in systematically providing a fair administration of justice. And it's that national effort in the interaction between the academy and the real world, which I think is the true vision of this center. So again, I want to thank the Quattrones for having done an amazing job in this. And also thank everybody who was part of this conference, as well as a number of people who are apparently on the Amtrak train trying to get here for this conference. Obviously, Amtrak hasn't adopted fully the systematic avoidance of errors that we would hope. But we are looking forward to them making it to the conference when Amtrak finally comes into Philadelphia Station. So, again, thank you all. It should be a great conference and a great day, and I'll turn it back.
Thanks, Mike. We're getting a little bit of a late start, so I'm going to curtail the 2.5-hour talk that I was about to give and shorten it to just a few moments. But I did want to sort of set the stage for today and maybe map out where I think we're going to go over the next day and a half, where we hope to go. When we called this conference a systems approach to convictions integrity, what we really, I want to kind of unpack those words a little bit. So what we mean by conviction integrity is a goal that I think can be shared by everybody in the criminal justice system, which was summarized by one of my colleagues as, we all want to get the right guy in the right way. I think every participant in the criminal justice system can agree on the point that when a crime is committed, we want to make sure that the person who has committed that crime is held appropriately accountable, and that the process of investigation and prosecution and conviction is conducted in a way that protects our individual constitutional rights and holds the system to its highest societal ideals. But at the same time, when we talk about a systems approach, we're talking about the criminal justice system as a single enterprise and not individual cases. And we're talking about taking a step back from the adversarial system, a step back from prosecutor versus defender, from society versus criminal, from judge and jury, and instead talking about how the entire system can function together for that one goal. And I think sometimes, because it's an adversarial system, we lose sight of the fact that as a system it has one goal, and that's to get the right guy in the right way. And so the reason for having this day and a half of talks is to help the criminal justice system look outside, talk to experts who have taken systems that, like criminal justice, are highly complex, high risk, high impact, fragmented systems, and have helped people work to see them as a single system with a single common goal. Now, the goal in aviation, the goal in medicine, and the goal in criminal justice at the end might not be the same goal. But in the morning, we're going to have experts from those industries talk to us about unifying principles and precepts that in all of those industries have helped the system be more efficient, be safer, and help all of the good faith participants in that system work together to reduce errors and mistakes and ensure the proper outcomes. In criminal justice, that means the fair administration of justice. And so what we'll do in the afternoon is we'll take the learnings and the vocabulary that we'll get from the morning sessions and we'll apply it with experts in the criminal justice field. And we'll look at innovative quality control approaches in criminal justice from a variety of perspectives, a DA's office, a public defender's office, the courts, and then we'll look at the literature and knowledge of the errors that we have today, because one of the principles that is in the safety literature is that we all have to learn from errors. So we have to acknowledge when a mistake happens, we have to look at it openly, bring all parts of the system together to evaluate it, and then we have to implement improvements to those systems that will make it more difficult for those errors to occur in the future. And that last part, the implementation part, is what we'll be dealing with tomorrow morning. So we will have learning from the outside this morning, applying that to the inside this afternoon, and then talking about how we implement and optimize those best practices to really change the system in ways that make it easier for everybody to do their jobs better tomorrow. A couple of administrative points. We are both recording and webcasting. So we will have microphones in the mezzanine strip there for Q&A. All panels will be held here in fits, and the panels will be divided between the panelists presenting and a healthy amount of Q&A. So when the speakers end, please come to the microphone and use the microphone so that we can record your questions for the webcast. And please also give your name and affiliation when you are asking questions. With that, I'm going to introduce our first moderator, Professor Carrie Colonnesi, and the first panel, Quality Control, a Comparative Analysis. Carrie is the Edward B. Shills Professor of Law and Political Science here at Penn, where he serves as the director of the Penn Program on Regulation. He specializes in the study of regulation and regulatory processes, including alternative strategies and the role of public participation and business-government relations in policymaking. He's been extraordinarily helpful to us at the Quattrone Center in formulating the agenda and thinking about the issues from the perspective of interlocking agencies and how that works. He's the author or editor of several books, most recently a new anthology called Does Regulation Kill Jobs that was published in January. And one of his most recent papers, Enhancing Public Access to Online Rulemaking Information, was recently recognized by the Environmental Law Institute as one of the year's best academic articles dealing with legal and policy solutions to pressing environmental problems. I should also say that he's being honored for that today, and he skipped the beginning of that to be here. So I'm extraordinarily appreciative of that. Kerry?
Thank you very much, John. Thank you for all that you have done to bring us here together, for your vision, your energy, and sheer perspiration, too, on all of this. I can't tell you the number of emails I get from John at about 3 or 4 in the morning. It's amazing. I also realize that this may be my last opportunity to offer my public thanks and appreciation to Mike Fitz while he is still Dean of the University of Pennsylvania Law School. And it is absolutely no understatement whatsoever to say that this law school is the great law school that it is today, thanks to Mike's tireless efforts. So on behalf of the faculty, students, and the entire Penn Law community, if I can do that, thank you very much, Mike, for all that you have meant. We're here today gathered to focus on how to, as John said, improve the integrity of the criminal justice system. The task that we face is one that is long-standing in our human existence. Alexander Pope, we know, opined that error is coterminous with humanity, even if forgiveness is akin to godliness. But if to err is human, I also think seeking to prevent error is also something that is deeply human. One only needs to think about what parents do for children. Don't touch that. As a way of error reduction. All of education and professional training and apprenticeships, whether in the earliest fields or the latest and most complex tasks, are all about ways of reducing mistakes and errors. It was in this very city in 1735 that Benjamin Franklin said that an ounce of prevention is worth a pound of cure. And it's always important for us at the University of Pennsylvania to find some way to quote Ben Franklin at the beginning of a conference. But today the desire toward prevention pervades all facets of our economic and social life. I happen to focus a lot on regulation, and one only needs to think about the regulation of motor vehicle safety design, the regulation of the distribution of electricity, telecommunication systems, both from the standpoint of what the government is trying to do and what industry is trying to do, is to manage risks and prevent errors. Now, we're gathered here today thanks to the vision and generosity of Frank and Denise Quattrone to focus on error reduction in the criminal justice system. But to kick this symposium off, as John said, we're looking outside the criminal justice system, and we have gathered on this panel this morning leading experts from the healthcare industry, from aviation, and from complex scientific and research laboratories. The errors that these individuals will talk about, systems that have been designed to prevent those errors, these errors are ones that literally can kill people, and lots of people. So it's an appropriate place for us to, those of us who are interested in improving the criminal justice system, to turn and look at what the experience has been in other realms. I will briefly introduce our panel members, going in alphabetical order from my right and moving down. Their full bios are in your materials. Our first panel member, Lee Fleischer, is the chair of the Department of Anesthesiology here at the University of Pennsylvania Health system, where he also chairs the Committee on Professional Liability, and he has served as a co-chair of the Patient Outcomes Steering Committee of the National Quality Forum. To his right, Chris Hart serves as the vice chairman of the National Transportation Safety Board. Previously, he was deputy director for air traffic safety oversight at the Federal Aviation Administration, and he also served as the FAA's assistant administrator for the Office of System Safety. To his right, Lucian Leap is a foremost pediatric surgeon and leading expert in health policy at Harvard School of Public Health. He pioneered research into the causes and the prevention of medical errors, and his tireless efforts led to the Institute of Medicine's path-breaking report, which I have a copy of here. The report is entitled "To Err is Human." And finally, after the three hitters get on base here, stepping up for the grand slam, Susan Silby is the Goldberg Professor, and I fully expect you will find that to be met. Susan Silby is the Goldberg Professor of the Humanities at MIT, where she's also a professor of sociology and anthropology and a professor of behavioral and policy sciences at the Sloan School. She is a past president of the Law and Society Association, and her current research focuses on management systems for containing and preventing risks in a variety of important settings, including research laboratories. We will start with Dr. Leap, and then we'll start in the healthcare setting. So Dr. Leap first, then Dr. Fleischer, then Mr. Hart, and Dr. Silby.
Thank you, Gary. Is this on? You here in the back row? Good. Well, I'm just delighted you have a Quattrone Center. I just think it's fabulous, and it's wonderful to come together as part of this and to try to help make a contribution. Although the worlds of law and medicine seem indeed worlds apart, I think we have more similarities than you may think. Both professions are concerned with issues of vital importance, life and death, literally, the things that people take most seriously, their health, their security. Both professions consist of highly trained professionals who have unique and highly developed skills, who have a great deal of power over their subjects, and that power is tempered by their professional concern for doing the right thing, their sense of a fiduciary responsibility to society. And both are people by professionals who really want to do the right thing. There are exceptions, but they really are very much exceptions. The vast majority of doctors, nurses, and pharmacists want to give good medical care, and I deeply believe that's true of the vast majority of lawyers, judges, police, and others in the law. But we all fall short. Looking at medicine from the outside, I see an incredibly inefficient, bureaucratic, and sometimes insensitive system that sometimes does more harm than good. And I am outraged that the number of preventable injuries and deaths, the corruption of those on the take from the drug industry, and the indignities that we impose on our vulnerable patients. Looking at the law from the outside, I see an incredibly inefficient, bureaucratic, and sometimes insensitive system that sometimes does more harm than good. And I am outraged at the number of innocent people who are sent to jail, the conditions in prisons, the corruption in some police departments, and the indignities we impose on our vulnerable accused. We and we alone, in our two professions, destroy tens of thousands of lives every year. And that's what we have to do something about. And that, I hope, is what this conference is about. Can law learn from medicine's attempts to change? Maybe not. We've had a great deal of difficulty learning from aviation and people like Chris Hart. One could say that we haven't learned very well because our error rates and our injury rates are still quite high. But it turns out that the checklists and crew resource management practices that aviation has taken to a high degree of professionalism turn out to be very useful in medicine. So I think we have learned some, but not enough. What I'd like to do is give you a very brief summary of what I see as our experience in trying to improve patient safety, and then draw what I think are some inferences that may be possibly helpful for thinking about similar problems in the law. It all began with data. It began with the Harvard Medical Practice Study from the School of Public Health, actually conceived and initiated before I came on the scene, in which we studied medical injury in 30,000 patients hospitalized in New York State in the late 80s, and found that nearly 100,000 people died in the country overall, if you extrapolate our results, because of medical mistakes. We had no idea at the time why people made those mistakes, but we discovered that there were people who did know things like that, people in cognitive psychology, people in human factors engineering, people who we never heard from, of course, in medical school, but we tried to learn from them. The first big insight was that we all make mistakes, all of us, all the time. That's part of the human condition. It's not because we're careless or incompetent or negligent, it's because we're human. The second big insight is that errors don't just happen. They don't happen basically because people are careless or incompetent or negligent. They happen for reasons. And the most common of those reasons are systems that we work in that are designed, if you will, to set us up to make mistakes. And therefore, if we want to do something about it, we have to pay attention to that. Like two medicines that are packaged in containers that look the same. Big surprise, and a nurse might mix them up. Like a doctor who writes a prescription without looking anything up and forgets that a patient's allergic to the medicine. Or asking residents to take care of patients when they've been up for 30 hours and have no sleep, something we all know makes them more likely to make mistakes. The third big insight is that you will never find these system problems and therefore be able to do anything about them as long as you continue to punish people for making errors, because if you punish them, they won't talk about them, and if they won't talk about them, you can't find out what causes them. And this led to a paradigm shift, because we, like the legal system, assume that if you punish a person for making a mistake, they and others will be less likely to do it again. Well, that probably works for misconduct, although I'm not sure the evidence is real solid on that, considering the high recidivism rate and so forth. But it certainly doesn't work for errors, for the simple reason that errors are unintended acts. They aren't misconduct, and trying harder won't make them go away. If you want to prevent errors, and most importantly, the harm they cause, you have to quit trying to change the people and change the system. The Institute of Medicine took these observations, convened a committee, produced the report that Gary's already referred to, and I think it's fair to say that although there were some of us, including people at this table, who were concerned about and working on these issues before the IOM report, that's really when the world discovered it and the patient safety movement began. Because they extrapolated from our Harvard study and said that as many as 100,000, 98,000 was the number they used, people die from medical errors. But the Institute of Medicine packaged that alarming revelation, which led the news on all the networks that night, with the second lesson, which is it's not due to bad people, it's due to bad systems. And fortunately, that message got through. And so that's what we set out to do. We set out to say, how can we change our systems to prevent mistakes, to reduce harm? And I think of it as developing in a series of phases. Phase one was the period of awareness, shock, and disbelief at these numbers. Prior to the IOM report, neither the public nor the medical profession was aware that we had this kind of a problem, and it's not too surprising that medical leaders questioned the numbers. There were actually papers written to prove that we were wrong, that this was not true. But then people began to look at their own results in their own hospitals and began to do other studies. And over a period of a few years, it became apparent what some of us who were participating in that study knew, and that is that was really a lower bound. Things are really worse than that. And indeed, figures have come out in recent years that show that the number of deaths might be twice as high. The second phase, after people got over the shock, was to try to see if we could do this, to try to implement systems changes. Hospitals began to look at their own systems and figure out what they could do. The Institute for Healthcare Improvement taught people how to make systems changes, the PDSA cycles and things like that. And as a matter of fact, in 2004, the Institute for Healthcare Improvement launched a nationwide campaign. They got 3,000 hospitals in America. There are about 5,000 acute care hospitals altogether. They got 3,000 of them voluntarily to agree to try to implement 6 safe practices with the proposition that if we could do this, if 2,000 could do it, we could save 100,000 lives in 2 years. Well, they didn't all implement all 6, and they didn't all do it quite right, and it didn't all go smoothly. But at the end of 2 years, we estimate that over 122,000 lives had been saved. That was awesome. That was impressive. Peter Pronovost at Hopkins showed that if you really did it right and adhered to a checklist and a proper team-based approach, you could totally eliminate infections associated with central venous catheters, infections that at that time were killing 17,000 people a year. He got so that they had none at Hopkins, and then took that out to Michigan where they did a statewide implementation. So these were exciting and impressive gains. But sadly, there are exceptions. Most hospitals still aren't preventing all their central line infections. Most hospitals still haven't implemented the checklist for surgery. So we still have a lot of work to do. And what we've learned from these activities is what I call phase 3, ushered in by Peter Pronovost and others, and that is that in order to do this, we have to work as teams. We have to collaborate. A system is really a description of a set of relationships of how we work together and how we do our work together. And system change, therefore, is really about changing behavior, changing how we do things. And we've got thousands of things to change, and change is difficult, and change is slow and irregular and doesn't go well. And you can't just mandate it. People have to buy into it. They either have to be part of the solution or they will be very much a continuing part of the problem. So that brings us to the 4th stage, which is where I think we are now, and that is the recognition that what we really have to do is change our culture. Most healthcare organizations are hierarchical, autocratic. Many people at all levels work together, work side by side but don't work together. The environment and attitudes are not those that are favorable to collaboration and teamwork. We much more emphasize independence and autonomy. And that's got to change. And that turns out to be very difficult to change. What have we learned? Well, first we learned if you don't measure, you don't know. You have to define the problem. Nobody was talking about this till we had some data that showed that we were hurting and killing people many more than we believed. Analysis is even more important, of course, trying to understand the why behind the bad numbers. And most importantly, you need local data. In order to get people in a hospital to change, they've got to see that they've got a problem there. Most people think our hospital's fine. When they get the facts, they realize it's not that way. The second lesson I've already alluded to, and that is it's difficult to make these changes. Everyone resists changes. The usual response is, I know there are problems out there, but they're not my problems. The culture is very securely entrenched, and making it different is not easy. We have strong vested interest in the status quo. The third lesson, first, that you have to have data. Second, that it's hard. The third is it must be a transparent and just culture. Everyone makes mistakes. It makes no sense to punish people for things they have no control over. But sometimes they do deliberately do things that are wrong, and there must be consequences for that. There is misconduct. It should be punished. Most errors are not misconduct, and we have to be smart enough to tell the difference, and we can tell the difference. It's usually not obscure. The fourth lesson is that leadership is crucial. Leaders set the tone. Leaders facilitate the people on the front line who have to make the changes. Without leadership, it can't happen. And the final lesson is that collaboration is absolutely essential. All of our issues, everything we do involves multiple stakeholders at different levels. They've got to work together. You work together or you don't work at all. So my recommendations for the legal profession are really sort of the same sort of thing. I have three. First, get some data. Find out what's going on. You need to do that to create a sense of urgency. You need to do that to know what your problem is. What are the facts? How many people are falsely convicted because of false identification, false confessions? How many people are abused by police? How many people are abused in prison? Do you know the numbers? Do you know the reasons for it? Can you break it down as to the various reasons these things happen? Well, you've got to do that. You've got to get the facts before you can really have a meaningful conversation. And a very major challenge here is defining what it is you want to measure. We spent a whole year in the medical practice study just defining what an adverse event is. This isn't simple. It takes some serious work, and all the stakeholders have to be involved. But you need to do a big populations-based study that asks some of these fundamental questions so that people realize that these are not just things that you read about on opinion pages in the New York Times. These are facts, these are lives, these are real mistakes. Our big breakthrough was learning to shift our attention away from error and onto harm and onto process. And it's much easier to get people to buy in when you say, in what way does our process not result in the kind of results we want, rather than to say who's making what mistakes and what do we do about it. Because as soon as you say who's making what mistakes, you're in the punishment mode, and that stops progress. I think that's a very, very major barrier, one that we're far from overcoming, but you're going to have to confront that. My second recommendation is question your assumptions. What will be your paradigm change? We had to change a very fundamental way that we thought about ourselves and our life, to say that errors are caused by, not by bad people, but by bad systems. You have to think about these problems in some different way. And I don't know what that way is, but clearly it's going to be different. What's the science behind the reliability of eyewitnesses, for example? What's the science behind confessions? Does use of a double-blind lineup improve the accuracy and fairness? I don't know. Should we forbid plea bargains? Should we forbid sealed settlements? All these are hot-button issues for those of us on the outside, and I have no idea what the answers are. But there needs to be a new way of thinking about these issues, and we've got to get out of the defensive mode and into the inquiry mode. And then my third recommendation is that you need to collaborate. That none of this will work unless you have all the stakeholders at the table, literally at the table, when you are making plans to figure out how to investigate and understand these issues. So police, investigators, prosecutors, judges, and lay people all have to be at the same table when you do this. Who will do this? I have no idea. Is this something the law school will take on? Is this something the Bar Association will take on? I don't know. I don't know enough, honestly. But somebody's got to take responsibility to make this happen. Whose problem is it? Thank you.
Thank you very much.
Well, it's an honor and privilege to be here, and certainly intimidating to follow Lucian Leap. And I want to thank John and Carrie for the invitation, the Quattrones for funding this fascinating question. It's rare that I actually interact, except in the malpractice committee with the attorneys, except for the divorce attorney that I come home to every night. I'm going to actually follow up and really talk about my experience. This is the wrong... No, Fleischer. I'm not a Susan. Lee could be either way, but... So I'm going to actually talk about what we've been doing as far as measuring over the last, that's the one, number of years. And actually, I don't know if anybody, actually knows who created the first report in medicine asking about quality. Any idea who did this? No, it's not. It's actually Florence Nightingale. It was Florence Nightingale. So this is actually, as you can see, a very old report. And one of the problems that we actually have in medicine is everyone attacks the data. We're all data scientists, and everyone says, our patients are sicker than everyone else, and that's why we have higher conviction rates or different conviction rates if we were to apply to other specialties. As you can see here, London, much worse mortality than out in the country, and that's because they only took the sick people in London. Or maybe their practices in London were so much worse that they actually caused harm. And I think Lucian and his colleagues really taught us that, and hopefully I'll give some insights into the problems we have in that measurement and how we think about it in medicine. The other thing is, and many of you through the healthcare debate may have heard about the Weinberg Atlas, and in fact, Lucian's colleague, Atul Gawande, has written a lot about this and about McAllen, Texas, and the difference. And we know in medicine that your actual outcomes, the death rates, vary greatly throughout the country. So one of the key questions is, why is that? Is that because people are doing worse in some areas? Is that because of different areas? And actually, now there's a great debate at the group that I'm on, which is the National Quality Forum, of the influence of socioeconomic status. And in fact, we're starting to ask the question of, should we adjust for socioeconomic status, or should we acknowledge that people of different socioeconomic status have different outcomes? Is it that we get a buy because people actually go home to different environments? Or do we need to figure out how to improve those different environments? So as I think of the different areas in the country and what I hear about in law from family members in the law, that what do you actually need to acknowledge? What can you learn from variability from one area to another? And how much does that environment that you're in? Should the South Bronx be treated differently than the Upper East Side, or should we have the same outcomes in both of those places? And we need to figure out how to overcome those differences between those different neighborhoods. So what we've done in medicine, and I think it's great to hear the recommendations of Lucian and what he has pioneered, is a certain level of transparency. And I think that's what's attempting to drive where we are. So I can go on the web at hospitalcompare.hhs.gov and find out how well we do, at least in Medicare patients. And that's one of the problems that we all have. We actually don't have national registries except for those over age 65. So I can tell you how the elderly do, but I can't tell you how the up to age 65 do in many conditions. That transparency and that ability to aggregate national data is incredibly hard in the law. But I can say at Penn, we do no different than the national rate. Neither does Hershey or other academic medical center in the state, neither does Presby. And the ability to say what's fair in judging places is very complex. One of the interesting questions, which is as we do what's called risk adjustment in medicine, or adjust how sick our patients are, if you're at a really small hospital and you do poorly, are we willing to actually call them out for their bad behavior? We actually say we give small hospitals a buy because the members of Congress actually don't want to see those small hospitals, nor if you live in a small town, do you want to see those small hospitals actually close. So how to actually present the data and how to actually judge each other is something that we debate constantly. And actually now that's what at the National Quality Forum, we have an 18-member committee that sort of sets the standards of what Medicare uses for judgment. And what's interesting is they developed that committee. There are 6 providers, I'm one of them. There are 6 actual either health systems or insurers, and there are 6 patient advocacy groups sitting at the table who always remind us and ask us the question, what would the patient, what would the individual want? How do we balance getting it right and having narrowers with actually sometimes making actually unintended consequences? What are those unintended consequences? And in fact, what's very difficult now is all of you probably at one time will be a patient, is what is the patient-reported outcome, not just the health status, but what do they think about the care they received. So in actually, one of the hardest things we're actually still trying to figure out is what is the test question. I think Lucian started it, but it's now something that's evolving constantly. And we've gone from sort of hard outcomes, you can tell when people die, but just yesterday I chair one of the committees at the health system. People were saying, well, look, we get people through who are really, really sick. You know, our patients are sicker, we get them through, but the real question is, some people will die. But the next question is, if they're going to die, and we expect that there's a high probability of dying, do they die with dignity? Have we actually delivered the care at the end of life that we want to give? Additional questions. But if we can't actually get to the outcome, if you can't today define what the right number of appropriate convictions and what the right number of different interventions in the system, can you go backwards and actually make sure the processes are correct? Can you identify the processes that will get you the right outcomes? For example, if someone has a heart attack, we know certain medications are important to give. Does everyone get those medications? Now, the problem when you said, does everyone get them? Some people may be harmed by the medication. So you've actually got to create a very complex measure of, did they do the right process in the right patient? Did they do actually the right process of legal process for that individual? So we're doing a lot around until we get to outcomes and say we judge each other fairly, can we get to the right process of care? And what we know in medicine is this idea of evidence. People think evidence is actually immutable. Well, I will tell you, it changes constantly. I'm living in one of those worlds where we thought, we had one study that said beta blockers or drugs that slow the heart rate are the best thing around surgery. Then they finally did a study in 10,000 patients and found there's a lot of harm being done. So when you may start out, it's easy to find a process that improves the outcome, but then when you do more and more individuals and apply that process, that's when you start finding the unintended consequences. So it changes, but we also know that it takes a long time for evidence to actually get out into practice. This is thrombolytic therapy, so the clot busters in medicine after you had a heart attack. And what you can see at one point is, and towards the top in this around 75, you start to see on this side that there's a lot of evidence saying these things work. But it took years before they actually were recommended in guidelines. How do we accelerate people throughout the entire United States in adopting a practice that you at the Quattrone Center may actually identify as a best practice? Is that actually possible? Two ways. One is you actually write guidelines, and we fortunately in medicine have national standards. That's great, but the crazy thing is we have guidelines from the United States. We have guidelines from Europe. We have guidelines that two different societies actually say, no different than I would imagine different states saying, this is the guideline until the Supreme Court makes a decision. We don't have a Supreme Court. So in effect, we've got to get the guidelines right and be willing every 3 to 4 years, which is actually the standard of the American Heart Association, to reevaluate whether those guidelines need to change. Because we know we don't always get it right. We know there's constantly new evidence, but I will tell you that's really expensive. And who's going to pay for that? But we know in medicine, and this is what Dr. Leap and others have said, that Einstein, not everything that counts can be counted, and not everything that can be counted counts. The classic argument from the data scientists over at Spruce Strait, but we're not going to improve unless we start counting, and that's really been the focus. And what's been interesting to actually see is, as you probably know, as part of the Affordable Care Act, two things have been implemented. Everyone actually has to report their outcomes now. I showed you that on the web. And if you report, you got extra money. Where they're now going into phase 2, which is that the bottom 25% will lose money, and the top 25% of performers will actually gain money. So I want to talk about those two things for just a moment. Number one, what we actually know now is what you're seeing here. The control group had public reporting of outcomes. And the pay for performance got more money if they got it right. That professionals, in this case doctors, that reporting and having public reporting actually drove the performance. That paying people to do the right thing when they're professionals doesn't make it actually better and may disrupt, we've learned from our psychology literature, may disrupt those relationships. That the hope is that just putting it out on the web, Penn is competitive with Harvard, that we want to be as good as the others. The other thing to worry about in this cultural context of what you're trying to implement nationally is if you're going to start doing what the government is doing, is this paying for performance, is there's unbelievable unintended consequences for the safety nets of the world. Because the people in the beginning who may do worse, they may be just really poor performing hospitals, but they may be in areas in which they're the safety net, they're the city hospital. And if they lose money to put into practice some of these systems, they will never get better. So a lot of the Denver Health, who actually are the epitome of great care in this country for safety net hospital, worries about, are we getting it right? And this really goes, Peter Pronovost, who was mentioned by Dr. Leap, was one of my former residents. He has really pioneered this work, but he actually, when he did this idea of checklists, he asked the question in Michigan, working with Chuck Bosk, who's a sociologist who's actually a member of my department, and asked the question, how long are you successful at not having a bad outcome, a bloodstream infection? And what's really interesting is that the culture, how many people, the response who say we have a good culture, the culture in that area actually determines how long you can sustain that improvement. That if you don't fix the culture, as you mentioned previously, you're not going to fix it. And one of the things that we need to do, and we're having these debates with Medicare and nationally, is we really want to focus on team-based metrics. And I actually could think about, you don't want to say, is this prosecutor better than that prosecutor, better than the third, but maybe you want to say, is the office better? Because that will, and is the office combined with the actual police department better? Have an overall grade, because then they'll drive each other rather than disrupting the relationships by actually measuring it as a team, which is some of the themes that I think we'll hear today. It gets better. So just to end, to show you that what we do in our health system is we actually have dashboards. I know on a daily basis how many people have died, and we have red and green and yellow dots, and we can tell you how well people think of our hospital, how many people are readmitted, how frequently they die, and how well we do those measures of outcome. And we will know within a couple days whether we're out of whack. And that's the transparency that we're going for. Thank you for this invitation.
Thank you very much. Vice Chairman Hart.
He asked me to be brief, but I am an attorney, and that means my number one credo is never use one word when two will suffice. But I promise we'll be out of here by Sunday at the latest. Pen. Go to pen. Is it alphabetical? Yeah, there you go. It's collaborative, that one. Well, thank you for the opportunity to be here. It's a real privilege and honor to be here, especially on the panel with Lucian Lee, because it's his report that got me down this track in the first place. So it's very exciting to have the opportunity to come and talk about it in his presence. So I'm going to talk about the challenge. I'm going to talk about collaboration, which he also mentioned, because it's been a huge success in aviation. And because it's been so successful, lots of other industries have come to me. When I was at the Federal Aviation Administration, they came to me and said, how are you aviation guys managing risk as well as you do And what can we learn from you? So that's why I give my presentation in nuclear power and chemical manufacturing and petroleum refining and healthcare and banks after the meltdown they wanted to know. And there's so many industries, and I even had some that I didn't quite understand. So for example, a school board came to me and said, come and talk to us. And I said, I don't quite get it. And they said, well, you try to stop airplane crashes. Our airplane crash is when somebody drops out in the 9th grade. Wow, okay, that's pretty cool. So when John Hallway comes to me, says, come and talk to us, help me out here. Our airplane crash is when someone is wrongfully prosecuted and even worse, wrongfully convicted. So that's exciting for me to be able to see how generic these processes are and how, and I say in every one of those industries, I'm not an expert in your industry, so I'm not going to say one size fits all. I'm just going to tell you what worked for us, what didn't work for us, the context in which we applied it, and you apply that in your context and see if that might work for you. And then I'm going to end up with a suggested beta test. So here's our challenge, and all these industries I talk to have the same challenge, which is they are systems of connected subsystems. And because the subsystems are connected, then that means you make a change in one, it's going to have impacts in the other subsystems within that system. In our case, it's all very high tech, and I'm sure that's true in healthcare, and also most likely true in criminal, because I see a lot of new technologies applied in the criminal process, but because they're high tech, that means you're always kind of on a learning curve because you're forging new frontiers all the time. So reminds me, when I was in junior high school, I finally learned this dance. Well, sorry, that dance is out now. You're going to have to learn the next dance. So we can't sort of rest on our laurels. We figured that one out because we're high tech all the time, so we're evolving all the time. So in that circumstance, with this complicated system of connected subsystems, we see that mishaps generally result from interactions between the subsystems that aren't desirable, aren't maybe anticipated, and it's not just one thing, and that's the kind of the good news and the bad news. The good news is these systems are so robust that it takes more than just one thing, in our case, to hurt somebody or to bend metal. But the bad news is, because it's so complicated with the interactions, there's no one obvious point of intervention and say, if you just fix it right there, you would fix this problem forever. We don't have that luxury. So that's the challenge, is complex systems. So what do we do with the challenge? The challenge is, how do we understand when you make a change in one subsystem, what's going to happen to the other subsystems? That's what I call system think, is understanding how a change in one subsystem will affect the other subsystems. And the way they did it in aviation is collaboration. That's what Lucian Leib mentioned. And that means basically bring all the parts of the system together to do 4 things. 1 is to identify what the problems are. 2 is to prioritize them, because I guarantee you, when you start this process, you're going to identify more things than you'll have resources to fix. So then you're going to have to get smart about what's going to be front burner and what's going to have to wait and go on the back burner. Then you develop the solutions for the ones that are on the front burner, and then you evaluate whether those solutions are A, doing what they're supposed to do, and as Dr. Fleischer mentioned, B, not doing what they're not supposed to do, not having unintended consequences. So in aviation, this collaborative process was called the Commercial Aviation Safety Team, CAST. It consisted of the manufacturers and the airlines and the pilots and the air traffic controllers and the regulator. That was a challenge, getting everybody around the table at the same time to identify, prioritize, solve, and evaluate. That's been the huge success story in aviation, is getting that collaboration together. And it's such a success that in the first 10 years they did it, they took a stuck accident rate, because what was happening is the accident rate was coming down wonderfully for a bunch of years for lots of reasons, mostly new technologies, like, for example, jet engines were so much more reliable than piston engines that brought down the accident rate itself by quite a bit. Then there were simulators, so now you can put pilots through exercises in these simulators that you'd never want to do in a real airplane. I've seen seasoned, thousands of hour veterans come out of these simulators sweating through this ordeal they've just been through. Now if they see it in real life, been there, done that, and they know what to do. So simulators have been a huge, huge boom to safety in aviation. So that wonderfully declining accident rate around the early 90s started to get stuck on a plateau. So now the aviation marketers are saying, wow, we're going to have a problem here, because the FAA is forecasting doubling in the volume of flying in the next 15 or 20 years. So simple arithmetic tells you flat rate times double volume means that your Aunt Peoria is going to see smoking, burning airplanes on CNN twice as often. And at that point, it does not help to go to your Aunt in Peoria and say, don't worry, the rate's real low. Your Aunt in Peoria is counting how many times she sees smoking, burning airplanes on CNN. So that's why they were concerned, and that's why they did the Einstein thing, keep doing what you've been doing, you keep getting what you've been getting. They said, we're going to have to do something different, and that's the something different. They tried this collaborative approach to accomplish the system thing, and they fueled it with the key that we've been hearing about information, the data about what's happening all the time. So they have two sources of information. One is automatic sources, flight data recorders, and the second is from pilots themselves and mechanics and flight attendants and the humans in the system. So those information sources fueled this collaborative process and resulted in the first 10 years, took it off that stuck flat accident rate and decreased it by another 65%. And not only that, but they flew against conventional wisdom, which always says you improve productivity, you're probably going to hurt safety. You improve safety, you're probably going to hurt productivity. They actually improved both at the same time. Truly a phenomenal success story. My theory on why they were able to do both, because all these people who are collaborating, even though they're there talking about safety, they're thinking about productivity, so they're not even going to put an idea on the table if it's going to hurt their own productivity. That's my theory on how they were able to increase safety and productivity at the same time. Truly a phenomenal success story. So, very simple moral. If you're involved in the problem, you need to be involved in helping to develop the solution. If you're involved in the problem, you should help develop the solution. Now, that's not rocket science. That's not so tough to figure out. Why is it so difficult to do? Well, lots of reasons why it's difficult to do. First of all, it's human nature. Like Lucian Leap said, I'm okay, you guys got the problem. This is a variation on that theme because in this case, now the manufacturer is going to say if you just fly them the way you're supposed to and maintain them the way you're supposed to, we'd be all right. And the airline would say if the manufacturer would build them right and the pilots would fly them right, what's the problem? And of course the regulator, they would say, geez, if you just follow the regulations, that's what the regulations are for, duh. So in other words, everybody comes to the table saying, I'm okay, you're not. So get your act together and we'll be okay. So if people come in it with their own myopic, my stovepipe is fine, but yours isn't, it ain't going to work. And that's getting over that basic human nature has been a huge, huge obstacle for us. Then we have participants with competing interests. So we got labor and management. They're always harping at each other. I never understood that. It's sort of like so much like your end of the ship is sinking. I never kind of understood that thinking. But that's labor and management is always going after each other. After the Asiana crash in San Francisco, you know the airline's going to be defendant. You know the manufacturer's going to be defendant. They're going to be beating up on each other in court. Your fault, your fault. And now we're asking them to come and play in the sandbox together. So that's a huge challenge, getting these participants with differing and sometimes competing interests to work together. Nobody wants the regulator there. I'm not going to bare my soul in front of the regulator, especially when the regulator shows up with this look in their eye like, wow, there's going to be some juicy data crossing the table on this, and if I see anybody going 27 in a 25-mile zone, I'm going to whack them. So if they show up with their regulatory bent, I'm here to enforce, as opposed to I'm here and learn and improve the system, then that kills the program. So nobody wanted to be bearing their soul in front of the regulator. Meanwhile, the regulator didn't want to participate because the regulator says, wait a minute, this smells like a democracy. Everybody votes. What are we going to do? I'm the regulator. Time out, guys. The law says I'm in charge here. I'm the one who decides what happens and what doesn't happen. I cannot accept this democratic thing. It's really not a democracy. What it is, though, is a rich source of information for everybody to learn and for everybody to learn about each other's perspectives in a way they never could in the normal regulatory process. So now, by the time something exits this process, everybody's on board with it. They have an ownership interest in it. They know their considerations have been taken into account, and they understand everybody else's perspective in a way they never did before. So now they do it. They do it willingly. They tweak it when it needs tweaking. Regulatory process never enables tweaking without a new regulation. But now everybody's got an ownership interest in it. This isn't quite right. We need to tweak it, and they tweak it. So it's a totally voluntary process, but everyone must be willing in their enlightened self-interest to think out of their stovepipe and think of how they can improve the system. And the bottom line result is everybody wins when this happens, because now we're thinking of the system instead of thinking just about ourselves. So that's why it's so challenging, because the linchpin to this process is trust. And that's why it's so difficult to build and easy to destroy, because trying to build that trust takes a long time, and it's easy to destroy it. So here's what I'm going to suggest, again, with the caveat that I don't understand the industry that I'm talking to. I'm not an expert in it, so I'm not going to say one size fits all, but I'm going to say there is a common starting point, and that's what drives all of these activities. Is the common starting point is everybody sees the need to improve the system. So I would suggest a collaborative beta test around a troubling trend, and I would suggest a high-frequency, low-impact trend, because mostly what we focus on in aviation is crashes. That's low frequency, high consequence stuff. But we've got most of what CAS does in the commercial aviation safety team is going after the the high frequency, low consequence stuff, and that's really where they're eventually going to make the huge changes. And so I would suggest starting with a problem that's been troubling you for years and years, resisting remedies. You tried this fix, that fix, the other fix, not working. And if the trend lasts a long time, then just like Lucian said, that means the problem is probably not from the people, because the people have come and gone, and the problem is still remaining. That means, that almost certainly tells you that the problem is your processes and your systems rather than the people. So what that means is that then the participants in this collaborative process will be more willing to participate because they see this effort is intended to improve the system and not intended to punish them. Because that's when you say a punishment process, as Lucian said, the players are going to shut up. You're not going to get a word from them. But if they realize this process was created for improvement and not for punishment, they are much more willing to engage and have that collaborative process seek a fruitful result. So I would suggest looking for systems out there, I don't know how to do that, who would be willing to volunteer to try a beta test on some micro. I'm talking about crawl, walk, run here. This is the crawl part. I'm not talking about an industry-wide success story like we had in aviation, but a micro issue, and look at and find some systems out there that would be willing to take a micro issue that they've been troubling them for years. They've tried this fix, that fix unsuccessfully, and try a voluntary collaborative effort around that micro issue and see if you can get some volunteers to do that, because what you're going to need really is some experiential success stories. It's not going to be enough to have people like me talk about it and say, wow, this worked great in aviation, because people can say, well, that's aviation. I'm this other industry. That's not relevant to me. Well, the process is relevant to you, and that's why I say you need experiential success stories in your industry as opposed to just talk in order to make it move. So my suggestion would be solicit some beta test volunteers who are willing to collaborate and try this on a micro issue that's been troubling them for years, and see if they can show that will create a successful result. Because if it creates a successful result on some of your most troubling issues, then I guarantee you it's a success and it's going to work on your less troubling issues. So thanks again for the opportunity to be here, and when we get to questions, I'll be happy to take questions, but I'm excited with the opportunity to share this collaboration success with other industries, because the more other people succeed at it, the more we do too. Thank you very much.
Thank you. Dr. Silby.
So, we have had hospitals and air traffic, and now we're going to move to scientific laboratories. Very different. Small. Could be 5 people, maximum 100 people. Laboratories, research laboratories, are places of discovery and of danger. The hazards are large. The ultimate hazard is that we really don't know how scientific knowledge will be used or misused in the future. But the hazards are also immediate. People die. The people who die in laboratories are not as numerous as the people who die in an airplane crash. But these are often students, young people at the beginnings of their lives. This tragedy at Yale was a young chemistry student working on a lathe. There was no safety guard on the lathe, and her long hair caught in the spindle. And because she was working in violation of the rules where you're never to work alone in a laboratory, she died, strangulated by her own hair. Quite horrible, as you can imagine. Oh, wait. University of California student, Sherry Sanjay, actually a graduate, who was working in the laboratory after college, getting ready to go on to graduate school. I think she wanted to be a lawyer. She was working in the laboratory, and she pulled the plunger out of a hypodermic needle in which she was moving a pyrofluoric chemical from one tube to another. And because she pulled the plunger out of the base, the chemical met the air, exploded. Because she was not wearing her lab coat, which is required by the rules, and her synthetic clothing burst into flames. She was basically burned down to her bones by the time the fire department arrived. She died a week or two later in the hospital. This laboratory had been inspected 3 months before. The inspectors had seen that the students were not wearing their lab coats. The inspectors had seen that the laboratory was crowded and messy. It was crowded and messy, said the professor, because he was temporary space and he was waiting for a bigger lab. He didn't clean up. He didn't change the practices. University of California was indicted on criminal charges, and so is Professor Patrick Harron, who is still under criminal charges. He has been indicted, he has not been tried, and he has not negotiated a plea, as did the University of California, who settled the case. Now, why is it not going? Okay. So what I want to do today, in my remaining time, is I want to just show you very quickly some data that describes the ways in which safety culture has emerged in our public discourse as the solution to all sorts of problems, and we've already heard it today. We have to change our culture. Well, as a professor of sociology, I'm going to tell you, not easy. Not easy. I'd also suggest that when we blame culture, that's the black box for everything we don't understand. Okay? But the solution to changing the culture, the most prolific and most well-touted solution, which we've already heard today, and which is the impetus for this conference, is that we should build systems. Systems for generating constant improvement and will, over time, create a safety culture. And what I want to basically do is walk you through very quickly, and I'll start to speak a little bit more quickly. I want to give you the results from 5 empirical studies showing how the management systems that have been created to try to contain and improve the hazards in research laboratories are working and not working. I will talk about the impossibility thus far of collecting reliable data, how the errors are built into the data collection system. I'll talk about therefore uncertain results that these systems will improve output. And then I will give you the better story. And the better story you've already heard, and that is that collaborative teams seem to have the best results in making change, at least in the laboratories we have studied. And I'll end with a very quick description of a study that does a comparison across institutions to suggest that, in fact, it is not just results from one. It can be generalized. Okay. If you look at this, in 1970, no, you never found the phrase safety or the word safety and culture within 5 or 10 words from each other. But by 1990 and by 2007, it was constant in the popular press, whether you looked at law reviews, whether you looked at engineering journals, whether you looked at the New York Times, the Washington Post, it exploded. Well, when something like that happens, what you see is a fashion. It doesn't necessarily mean it's true. It just means that everybody's talking about it. So the first thing is be cautious, because it could be a hula hoop for all we know. So you don't even know what a hula hoop is. It's so dumb. All right. So how are we going to create safety cultures in the laboratories? This is the problem. The university is a hierarchical system, as is the criminal justice system. It starts at the top with the president, then goes down to the provost, the dean, then we have a department chairman, and then in every department we have an individual little entrepreneur running his or her own laboratory. The problem and the danger lies in the red circle. Those are the students who work in the laboratory, those are the postdocs, those are the lab technicians. They are the ones who die, lose their eyesight, get maimed. The safety system is located in the green circle. That is the Environmental Health and Safety Office, whose job it is to patrol, to surveil, to cajole, to teach how to be safe. But once you open up that green box, that's what it looks like. They are a set of specialists in radiation, in chemical hazards, in bio-waste, in just ordinary hazards like electricity or big machines, as what the lathe on which the Yale student died. They too have to be integrated to work with the people in the laboratory. And then when you put it all together, it isn't a very clear linear system like was up on the beginning of the criminal justice system. We make pretty charts like that to suggest, okay, we can put something in the middle, in the beginning of the pipe, and then we can follow it out to the end. But this is the mess. These are the people who have to interact with each other, in this case, to produce higher education and research science. So how are they going to do it? They're going to create a system they call an environmental health and safety system, in which they will specify all the roles and responsibilities of every single actor. That is from the president and the corporation down to the lowest undergraduate in the laboratory, what their responsibilities are, in a manual that is this thick. Now, of course, it doesn't exist this way because we don't use paper anymore, but it is a series of infinite screens and clicks that you have to go through. Not easy to find what is your role and responsibility. And for every role and responsibility, there are standard operating procedures specifying how you do any one of the acts that compose your role. The central tool of this system is a database that contains not only the specifications of the roles and responsibilities, but it also contains the lists of hazards, the dangers in each lab, the registration of every laboratory, and what each member of the lab has to be trained and tested to be able to do. What a system is, and nobody has really said it thus far today, so I think it very important that I say so. A system is simply a processor of information which is supposed to observe itself and respond to the information about itself. What is essential is that there be a feedback loop between the observation and the response to the information. If the feedback loop is broken, it is not a system, or at least it's not a well-functioning system, and therefore cannot learn and cannot improve itself. So in this system, it was, as I said, to make itself observed, to make visible the multiple lines of communication and transaction, to support a new distribution of work roles, to allow the organization to observe itself by recording the work and the goals, to improve the ability to support research in the laboratories, to name all the responsibilities and create accountability for that, and to improve ultimately compliance with legal regulations, but also obviously to promote safe and sustainable laboratories. So, here's the first study. How did they create the data system? To create the data system, they went and hired some computer scientists, laboratory scientists, managers, experts in radiation, biohazard, etc., sat for 9 months with the computer designers to create an information system in which they would record every hazard that exists in every single lab, and they would record it by room number, by the professor who was in charge, and any time a student was going to work in that laboratory, they would have to sign on to this system and make sure that they had the appropriate training for the listed hazards in that laboratory. Now notice I've circled the date. Simple little thing, most times we make forms out, we put the date on it. Why wouldn't we put the date on it? Well, it turns out that this was a source of contention in the design. Well, why should we put the date on it? If we put the date on it, and then it turns out we come and inspect this lab, and we say that in fact they haven't put labels on the chemical jars, and it has the date, when the EPA comes back, they'll see how long we've been out of compliance, and it's $27,000 for every day we're out of compliance. We better get rid of the date. Okay, so we get rid of the date. Now, of course, anybody who knows anything about computers knows that you can go in and figure out what date this data was put in, but we get rid of the date. So the EPA shouldn't know, but we also don't know anymore, and therefore you can't say to the people, you know, it's been quite a while since you cleaned up this laboratory. Another thing is, shall we record the findings when we inspect the laboratories? Shall we indicate what kinds of hazards have not been taken care of? Shall we use scales, or shall we use descriptions? Well, there is, as we call this, there's both the desire and the fear of data. Some people want more data because they want to be able to describe good practices. Shouldn't we tell people what they're doing well as what they're doing bad? And should we have checklists? Well, how could we have just checklists when every lab is different? This isn't industry, after all. These are research laboratories. We're making it up. How could we know in advance what the hazards are? So how can we have a list to check off what we've done wrong? And then, shall we give them an overall rating, or shall we, say you've got an A, a B, or a C, or shall we list? You've got 1 violation, you've got 20. Well, as they said, if I go in a lab and there are really only 3 hazards and 2 of them haven't been handled right, 2 out of 3, is that the same as if I go in a lab and there are 100 vials of radioactive material and only 2 are not covered? So how shall we know what's a seriously out of compliance lab and what is just a minor? And in the end, they say, well, should we check each one? Is this serious or is minor? Well, in the end, the desire for internal and external accountability, they want to represent what is good about themselves, but then they fear giving too much information. They fear the misuse of information, and then they fear the fact that it will be inconsistent. And for a year, the arguments between the desire for information and the fear of its misuse ends up with a system which is almost incomprehensible and of no use whatsoever. So the negotiations end up producing exactly what every observer has found in most major database systems, is that they have not reliable information. And now I'm going to show you this. So having created this system in order to record indicators of the safety culture, what do we learn by looking at the data? Lots and lots of missing data. Not simply particular cells, but entire inspection cycles of the laboratories, that which was supposed to be the grounds of which you would improve from month to month or cycle to cycle. And since the initiation of the system, what we found, over 10 years that this has been in process, no one has analyzed the data, that which is supposed to be the basis of the feedback loop and the improvement. So this is what the most recent analysis that my students have produced. From 2005 through 2012, I've circled all the missing cycles. If you're a statistician, you can't use most of the data because you have so many missing cells, so we can only start analyses from about 2008 and simply ignore the 2 that are missing in 2010 and 2011. But it's very hard to do comparisons when you have so many missing cells. So, nonetheless, this is not the best results because we have so much missing data. When we do the analysis, which the system did not know until we, the outsider observers, produced, 2 departments account for 50% of all the violations found in the university, even when we control for the size of laboratories. The violations doubled between 2005 and 2012 and peak in 2010, and nobody can explain why. Chemical storage, housekeeping. Housekeeping means not wearing your lab coat, exactly what Sherry Sanji died from. And I might say that the explosion was even more exaggerated than would have happened with just the pyrofluoric acid from the hypodermic needle, because when she burst into flame, her hands went out and there was such a mess that it exploded too, exactly what the inspections had observed 3 months before. So, and it turns out that not wearing your lab coat and having messy lab table is the most common problem in university laboratories. And the satellite accumulation areas, that means the storage of chemicals waiting to be removed off-site so they can be decontaminated somewhere in the Midwest. Labs with managers have fewer violations than labs without managers, and as interesting, tenured faculty violate much more than untenured faculty. Now there's a good argument for those who want to remove tenure. Okay. All right. The point of this is that the recorded violations are not a perfect or reliable measure of what actually happens, and we needed to find other information of what really happens in these laboratories. Though this is an image, again, I've circled, if you'll notice, the orange and the red, those are housekeeping and not wearing your lab coat, and among all the violations, they are not the most numerous, but they may be the ones, just as indicated earlier, that if we could clean those up, we'd make a big difference in the safety in these labs. Okay, so what we did was a survey of 177 universities. We wanted to know whether what was going on in the one that we looked closely was perhaps going on elsewhere. And we hypothesized that there would be variation from school to school, and that the legal environment, that is, whether they had legal counsel, that's spelled wrong. That should have SEL. Lawyers in the room know that that's spelled wrong, right? And whether you belong to an EPA network, and what was the status of the university, whether you were one of the high status, high science producing universities, would affect what kind of a safety system you created, what kind of a culture you were trying to produce on campus. And we would measure that by the array of officers and staff you had, the complexity of your system, and whether it was centralized or decentralized. And our dependent variable would be whether you had an effect in the labs. And we had various measures for the effect of labs, whether people routinely wore their lab coats, whether the degree of compliance, whether the faculty recognized their responsibilities. And that was based on previous information. We expected that those who had counsel on staff, that those who belonged to the EPA, and those who were more higher status might affect the penetration into the laboratories. But we found none of them. In fact, nothing predicts penetration into the laboratory except if you belong to an EPA network, which is the first bit of information or evidence that collaboration worked. Okay? So those who belong to a network of other laboratories, other universities, and work with the EPA, they have the most effect in the laboratories. Finally, I'll skip this, but oh no, this is the good news. The good news is in a study of the one university, we found that what worked to change the laboratories was when teams of managers who went from lab to lab and worked as teams across the departments, worked together to share their problems with getting faculty to comply, worked together, they had the biggest effect in changing the practices in the laboratories because they became a resource for the people in the labs to say, well, what should we do better? How can we make things safer? And this group of actors succeeded. And I think what I'd like to end with, and I'll skip my last study, but what are the conditions that make these collaborations work? I think this is very important. It's not just teamwork. There have to be certain organizational conditions that allow teams to succeed. Having some external observer matters, that there be some ultimate accountability, but that accountability should not be daily, and it should not be too close, because people have to be given freedom to experiment. They have to be given freedom to make some mistakes, to investigate and figure out for themselves what will work in this situation. So they need some slack time and macro, not micro management. Being an outsider seems to help. Most of these people were hired into these jobs, these coordinators who would go around to the labs. They were not insiders, but they needed time to become insiders. And they needed time to meet by themselves in special designated places without close oversight. And who are these people? For the most part, they're middle-level managers. They're not at the bottom, they're not at the top. And so my last study, which I will very quickly say, is that people who have some expertise, some autonomy, and frequent interaction among themselves and with the regulators are the ones who end up changing the system or allying with the regulators. Those who have low expertise, no autonomy, with little or no interaction, they see the rules and the regulations and the regulators as a threat to their jobs or to their organization. And finally, those with the highest expertise, the highest autonomy, those are the tenured professors, and no interaction with the staff, they see it as an obstacle and they try to avoid it. So, people in the middle, folks, they're the ones, and you give them the freedom to work among themselves. Thank you.
Thank you very much. Thank you very much to all of our panel members. We have a few minutes for some questions, and fortunately the way the conference has been structured, the next panel will be raising some of these same and extending some of these same issues, so the conversation will continue. But I'm open to any questions for any of the panel members from the audience. There are microphones in the back if you'd like to step up to one of those and introduce yourself. And we'll have time for a couple of questions. We've got somebody right here.
Thank you. I'm Sam Gross. I'm from the University of Michigan Law School, and I'm deeply impressed with this presentation. I have a question for all of you, but really, I think most for Dr. Leap and Dr. Fleischer, because when you talk about medicine, you emphasize the primacy of data. And I want to describe the data situation that we're dealing with here. Dr. Leap mentioned that studies showed that some large number, perhaps 100,000 deaths a year were caused by medical errors or possibly medical misconduct. Those are observed harms. What we're dealing with here, if we're talking about errors, are not harms. The harms are crimes that are committed, but judgments about who is responsible for those crimes. Post-dictions, human judgments that occurred later on, and the information we have about the harms that we're concerned about, the harms that we're focusing on here are errors in those judgments. As a result, we don't observe them directly. We find out about a very small number of them, and after a great interval of time. So the analogy to medicine would be that of the deaths that you're talking about, regardless of what caused them, we actually learn that the patients died in some small and unknown fraction of the cases, perhaps 1 in 10, perhaps 1 in 100, and that we learn about this perhaps 5, 10, or 30 years after the fact. That's the data situation we're coping with. Now, this is an impossible question to ask, but given that, and given the essential nature of gathering data and counting it, have you had any chance to think about, or can you offer us any ideas on how to begin to apply the systems you're talking about to this deeply data-impoverished problem we're dealing with?
Wow, that is a toughie. I would say this, that although I think you're absolutely right, that there's a big difference, you have to know what the facts are. And so the first step would be to gather the data you have, even if it is 30 years. I mean, do we know, do we have a way of collecting and analyzing all of the cases, for example, where the DNA analysis later showed it was not the right person? What have we learned from those data? And it's a lot harder to learn it 20 or 30 years later. I think there's no question about it. The other thing I would say is you would get a lot out of studying the process and we talked about observation being essential. It would be very interesting to see what would happen if you had an outside observer watching 100 interrogations and jotting down to what extent they followed the rules or did not, etc. So you could do a lot in real time about the process that would be very helpful. Please.
Yeah, I mean, we've had the same problem. I mean, we want to get to outcomes, but we actually are measuring processes now. So again, mapping out the process you showed us in the beginning, the slide of the process, the legal process. So in those cases in which you know, or just mapping out your entire process of how someone gets prosecuted and convicted and all the steps along the way, and if you could identify what are the failures in those steps from, in my field, which is anesthesiology, we learn from our failures, which are rare events. We didn't learn from prospectively looking at who died and sort of the way the cardiologists looked at it. We studied each failure, learned how we had to fix the system, and then learned what process we had to change. So that would be the way I think you have to start until you can actually figure out and that's why I said, I'm not sure what the right outcome measure, what the numerator and denominator, it's really hard from your perspective.
We had an analogous situation in aviation because the bottom line metric for us is the number of airplane crashes. But we can go years without a crash, so that means how helpful is that information to tell you whether you're getting better or getting worse? It can tell you whether it's kind of cool or kind of warm. What you really want to know is it 71 going to 72 or 71 going to 70? And so we had a similar challenge of trying to figure out how to get more granular data to be useful because the number of crashes, that's what the public pays attention to, but it didn't help us as safety experts to know whether we're getting better or not.
You have to try to imagine a world in which 99% of airplane crashes are never observed. That's the world we live in.
Well-
Except, Sam, we do have data. You know we have data. We have data on what goes on in a lot of interrogations. The police have data. The criminologists and the sociologists and law professors have done studies of interrogations. We also know that there are serious problems in most of the labs that handle the evidence, and we know that there is very serious problems with eyewitness testimony. So we know, at least at those three places, that there are problems.
You could always go backwards and go to near misses, which is, I think, what medicine is doing more frequently in aviation, and not say it's the wrongful conviction, but it's the case in which they almost put someone on trial. That could be the new outcome that you at least start with.
Okay, I think there's one more question behind you.
Yeah, my name is Jeff Deskovic. I'm with the Jeffrey Deskovic Foundation for Justice. There's many different causes of wrongful convictions, from on the level of the police, defense attorneys at times, prosecutors, even judges, both at the trial level and the appellate process. When it comes to discussing prosecutorial misconduct, there's many studies that show it's a prevalent cause, from studies from USA Today, the Innocence Project, I think it's the North Carolina Innocence Project, California rather, the Pew Center. Yet in the field, many organizations that work in the innocence space, the language that's employed is a few bad apples. Whereas if it was just a few bad apples, there's no need for studies. All the documented instances wouldn't have taken place. All the different studies wouldn't have even down to a statistical level. I know that you want to, in terms of reforming the system, it's really important to pitch the tent as wide as possible, to bring in as many partners as possible. And I also recognize that many organizations in the space, they rely on cooperation from district attorney offices in order to secure DNA testing, even in non-DNA cases, with the idea of going bird in hand, present an innocence case to a prosecutor, have them review it, so it doesn't necessarily have to be litigation in court. You could go with both sides agreeing. So I realize those different concerns that go into it. Yet nonetheless, I do see it as a problem, because if you're gonna hedge, if you're not going to speak on the frequency of it, then it's hard to address that. So the question I have for anybody, or maybe multiple people on the panel, is coming from other disciplines, what is the way to move forward the language in which the discussion is held, coming from other fields where there are those multiple concerns? And just the last comment on that is, while I definitely recognize that there are good faith errors, I also think that there's a rush to judgment and to label everything as a good faith error. I mean, to me, if a prosecutor's office withholds exculpatory material, has these corrupt understandings with experts telling me what you want to prove and I'll prove it, that's not a good faith error. Yet there's a rush in language to often label things that way when the facts don't always necessarily bear that out.
Okay, there's a lot there. I'm going to ask the panel to think about that for a moment. We have one more question, and then I'll come back with both questions for you to comment and wrap up. We want to try to keep the next panel moving on schedule. So we will keep that last comment and question in mind.
Tom Hogan, one of the things that's going to cause a bit of an issue when we look at these is how will you factor in as an adverse event a false acquittal? Because one end of this is just the false convictions. So when we look at the doctor's side of it, it's going to be mortality. When we look at Mr. Hart's side of it, it may be the crashes. But when we look at prosecution integrity, it's not just false convictions, it's false acquittals. So I'm going to ask, while we have all these experts in the room, how are we going to factor this into our process analysis, which of course is what the Quattrone Center should be all about.
Okay, so the first question was about, do we sometimes too quickly assume that errors are just made in good faith? And second, what do we do about false acquittals? To some extent, both questions are ones that we will be taking up throughout the entire day and through tomorrow and in the weeks and months ahead. But why don't you use that as an opportunity to respond and conclude our panel?
I think Tom has a point. Your errors are either false acquittals or false convictions. I think I'd go back to the point that Christopher Hart made. Start with something small. We're not going to have the whole system and figure out, as I did, oh, I want to penetrate the lab, but you have to find out, well, are they wearing their one little part in the step? How are your interrogations done? Let's see if we can do something about that. Let's do something about improving the laboratories. Two things. Let's see what happens if we just work on those two. Maybe do something better on legal counsel. I don't think we're going to have a measure of the outcome of how many false acquittals and false convictions are we changing. But maybe we can do something about improving steps along the way before we get the whole model for changing the valence on the last variable. That's what I would say.
And in full disclosure, thank you, Aunt Susan.
Aunt Susan, that's my nephew. It's my nephew.
I think there are two different issues here. One is how do we get better information, and the other is what difference will it make? That is, who's going to make some changes, and what changes will they be, and what power they have to do it. As Susan said, we have a lot of information about problems, but that doesn't seem to change the process. I'll leave you for the next 2 days to figure that out. But my recommendation is a variant on what Susan just said, and that is, I think there's a lot to be gained from knowing more about at least a part of it, and pick a process. If you mentioned the prosecution process, well, one needs to then define, I know nothing about this, so this may be way off base, but looking at it from the outside, one needs to define what are all the appropriate steps in the prosecutorial process, what are the right things to do, what are the wrong things to do, and then having defined all that, do a study of 100 of them and find out what fraction of them are meeting the criteria and which are not. I think you would find the numbers are horrendous. That you would find that it isn't a bad apples. It's a system that good apples function in. And unless you know the details of that system and have the facts, you don't know where to start to do something about it.
I would put an example on that from aviation because, you know, we can talk about good apples and bad apples. So let's talk about somebody who's sitting on the end of a runway and there's a thunderstorm out there and am I going to take off into that thunderstorm? So then the assumption is the person takes off into the thunderstorm, they're probably a bad apple. But if you look at the compensation that their airline gives them, suppose their airline compensates them for a mission completed. Then is that a bad apple who's trying to complete the mission because that's what the system encourages, or does that mean we need to look higher and not pay people for completion of mission because that can have potential adverse consequences? Just like when one of the pizza delivery outlets started rewarding, saying if you get your pizza more than 30 minutes after you ordered it, then it's free. And now people are running stop lights and doing all kinds of horrible things because of the system that they're in. They're trying to get there in the 30 minutes, so it's not free. So I would be careful about the characterization of good apple, bad apple, and look deeper at the system in which these people are operating, because I'm going to assume that most of them are good people trying to do the right thing under sometimes difficult circumstances.
And with regard to the first question, I actually think you need to change the conversation. I think Lucian has done this, is assume everyone's at least trying to be a good apple. And the more you change the language that this is a system error, then the bad apples become really clear and you can start addressing them. But if you start with the assumption that everything is bad apples rather than it's a system, you're never going to be able to take those few and really push against them in the way that we're just starting in medicine. With regard to the second question, I actually think mammography is a classic example of what you're trying to actually say, and it's a societal question. We can screen more women, and in fact there was news just a couple days ago, and we can pick up more breast cancers, and we can cure those women. We also can find tons of false positives, and then they'll undergo biopsies, and then they'll get harm from the biopsies. And what we as a society have to decide is what's the balance? What are we willing to do? What's our tolerance? And I think in medicine we're still trying to decide wrongful convictions as well as allowing appropriate people to go free. I mean, I think it's not quite the same, but I think there's an analogy in some of the questions we're asking internally in medicine, which is actually what the Choosing Wisely campaign is, which is the Choosing Wisely campaign in medicine right now is we're trying to say to the public, more is not better. But you have to understand the implications of not getting more. And Consumer Reports is actually involved with the specialty of educating people on what those trade-offs are.
Well, we have a trade-off in our time. The more time we spend on panel one, the less time we have for everybody else. I want to thank this opening panel for really getting us off on a terrific footing. Thank you one and all, and we'll lead into the next part of this 11 o'clock will be the coming back point to start panel two. Thank
Yes. Thank you for taking the time to talk to us earlier.